This is our Halloween edition. So no, I did not take corporate casual too far today. I am your older, slightly more worn down Visco girl. This is my interpretation. So thank you to Dr. Christie Barnes, one of the coolest doctors who will allow me to be silly. We are actually at the Lauritzen Outpatient Center. And before we get to that, I want to put in our natural disclaimer. Shockingly, you're not going to trust the advice I give today of any medical condition. But as we talk throughout the day, if you have specific questions about your treatment plan, your certain conditions, especially related to ear, nose, and throat issues, we ask you to seek out the advice of a professional such as Dr. Barnes. So thank you again for joining us. Thank you for allowing me to participate in the Halloween fun. I may stay hydrated. I'm getting a little warm in my Save the Turtle sweatshirt. So if I take a drink here or there, I apologize in advance. But we talk about that you are part of the ear, nose, and throat, or the acronym ENT team here with Nebraska Medicine. And you specifically studied above and beyond and became highly specialized. So your title is Rhinologist.
That's correct.
Can you explain what that is?
Well, it's the nose of the ear, nose, and throat. So it's an additional year fellowship training specifically designed for sinus surgery, skull-based surgery. So I focused in on that nose part. So, and in ENT, there's lots of subspecialists that focus on little areas.
Okay, and we're here in a typical exam room at the what we call LOC, the Lauritzen Outpatient Center. Describe where that is located. It's pretty convenient midtown.
Yeah, easy to get to. We're on 40th and Leavenworth. I think one of the really appealing things about it is people can just drive into the parking garage and avoid the chaos of the big campus.
Absolutely.
But beautiful facility that just came up about 2 years ago. Nice glass front, so it's a great space for us, and we share with a couple other specialties, and pretty happy here.
Awesome. And then there's also same services out west at the Village Point Health Campus.
Yeah, and I actually spent a lot of time out west at Village Point. We have another great facility there, very simple for parking, easy access in and out. I think patients these days really prefer that. And right off of Village Point, so you can do your shopping and then come see me to get your nose checked out.
Wonderful, wonderful. As I mentioned, I'm going as the Visco girl today, so another acronym everybody needs to know. I don't even know what it stands for, but VSCO. It's a popular photo editing app amongst tweeny girls.
Sure,
I only know about this because my daughter's in that age range, and so I used it as my excuse to just dress in pajamas for work, which is happy Halloween.
Absolutely. No, I love it.
So this time of year, we know the weather is changing. It's getting colder. I imagine that's kind of upping your patient intake. Are there more people coming in with allergy, sinus? What are you seeing these days?
Yeah. So we're seeing a lot of different things. This time of year brings in the bad allergy sufferers, molds. Really, especially after a rain, we tend to get increase in mold spores. We're also seeing a lot of ragweed is starting to go away. Because of the freeze, the colder temperatures. But as the temperatures cool down, we start to see nosebleeds. We see a lot of epistaxis. Cold season will bring a bunch of different things. We've got tonsillitis. Lots of different throat conditions, pharyngitis. We'll also see, a plethora of different kind of cold-related symptoms, sinusitis this time of year too. So
I know I've worked on been lucky to interview all the way up to Bill Moose, the athletic director at UNL.
Absolutely.
We interviewed him about that he had a sinus procedure done, relatively routine. But you talk about the nasal polyps and like some of the things. Are those the most common routine surgeries that you face?
Well, nasal polyps probably make up about 20% of sinus problems. So other sinus problems are kind of more related to anatomic blockings of the sinuses, and then recurrent infections of the sinuses.
Sure. So people just become miserable enough that they think this is more than just a cold every year.
More than just a cold, and I'm getting it over and over again. So.
Okay, so those are some of the common things, and the reason why we call this live chat the scary ENT cases. Rest assured, you're in excellent hands. It's never a scary situation to be treated in Nebraska Medicine, but some of the cases are a little unnerving when you describe what you've seen. So you gave me a very high-level overview of a gentleman who had come in, and you'll have to explain what the initial symptoms were, but it traced back to a tumor. So explain that to our audience today.
So we had a young man presented actually to our ophthalmologist complaining of difficulty seeing in his periphery.
Okay.
So suddenly he was just kind of, daughter was playing and was like, wait a minute, I can't see very well out that side of my eye. And then he looked and he was like, wait a minute, I can't see this very well either. So visual changes presented to an ophthalmologist who examined him, and lo and behold, he did have some deficits in his periphery, so the outside of his vision. And because of that specific finding, he underwent some imaging of his head, and they found a pituitary tumor.
Okay.
And this is actually a common way that pituitary tumors present, is visual loss. When they get to a certain size, they can actually press up on the optic nerve, which is the nerve that supplies the eye. And when that happens, it gets a pretty specific vision loss.
So that's interesting because, again, the ENT, ear, nose, and throat, the eye isn't part of that, but that is something that you guys...
Well, it was about 100 years ago.
Was it really? Okay,
yeah,
that's interesting.
It used to be eyes, ears, nose, and throat.
Okay.
But we parted ways in good faith a while ago.
But that's interesting. That's something that would start off as a vision issue ended up leading to you all.
To our office, yeah. So when the pituitary was identified, pituitary mass was identified, he went through our endocrinology clinic, who we interface with. Dr. Drinzik is one of our excellent endocrinologists who specializes in pituitary tumors, and then saw myself and our neurosurgery colleagues. So Dr. Thurell, Dr. Sherdell, and Dr. Gard are three colleagues that work with Dr. Pate and I on specifically these skull-based tumors. And I want to say a skull-based tumor is really just a growth along the base of the skull where the brain sits.
Interesting.
And so pituitary tumors fit into that category.
So, we talk about the common things that you treat, but something as specialized as skull-based surgery, I don't know if a lot of people know that we do that.
Yeah,
so it's
sure
wonderful that some of these services, you don't have to travel far, like it's right in your neck of the woods. And you really wouldn't know that you need something that intense or that specialized until you come in and have that initial evaluation.
That's true. Very, very true. And this gentleman, because of the size of the pituitary tumor, we needed to move rather quickly to decompress it so that we could actually save his vision. And it used to be done about 20 years ago. If you had a pituitary tumor, you'd actually have to have a really big incision across your head. You'd have to have a craniotomy, which is removing the skull and approaching it from above. Nowadays, we go through the nose with the same instruments that we typically use for sinus surgery. The patient doesn't have any incisions on the outside. It's minimally invasive. And we work hand in hand with our neurosurgery colleagues to do that.
That's awesome. That's just wonderful. It's amazing.
It's pretty cool.
Modern medicine.
I know, right?
It's as cool as saving the turtles.
Right, pretty close. I would say it's up there.
I need a little sip. I'm a little
please,
flushed.
Please.
All right, next question, because I am a mom, and that's the only reason why I know about this phenomenon.
Sure.
I imagine you see lots of random objects being shoved into nose, ears, throats.
Yes.
So tell us a couple of those spooky stories.
Well, yeah, if you're a parent, you know that kids will do crazy things. And so we will see, I've seen all sorts of different things. And just to give you an example, we've definitely I wouldn't say terribly uncommonly, I've found bugs in people's ears. I know.
No.
I saw a patient once that had a mosquito in his ear.
Oh, painful.
Yeah. So I pulled out a couple of bugs, but it tends to be more people that are outdoors, and and usually sometimes it's not even really discovered until later. They don't really have any symptoms from it. I've seen kids love to put beads in their ears.
Yes.
I can't wrap my head around why. But kids are an enigma, right?
Oh yeah,
we don't know
absolutely.
Why they do half the things.
Absolutely.
I've seen a nice little girl put a couch cushion in her nose. She just the stuff that kind of they stuff the cushions with, just thought it was a good idea to shove it in her nose. They get really smelly when they're in the nose. So that, and then probably the one that sticks out in my head as maybe one of the scariest or potentially grossest was a little boy who picked up, and this is a very little boy, but he picked up his grandmother's toenail.
Oh no!
I know. I even cringed thinking about it, but and it actually went into his airway, so we had to remove it from his airway.
How scary!
Yeah, aspirated it. So,
but everything was fine. You got it out.
Everything was fine. Got it out. No problem.
You lived to tell about it.
Lived to tell something you probably will not be, telling at graduation or those kind of stories.
Right.
It's probably one of his family secrets.
I was talking to a colleague, Christine, who you'll see on Facebook Lives here and there, about childhood, antics, and she had shoved a sunflower seed.
Oh yeah.
So shout out to Christine for being stupid.
She survived.
I have to say, with all of these stories, the natural next progression of a question is, what on earth possessed you to go into this line of work? You've seen some really crazy stuff.
Yeah.
Is it the satisfaction of being able to help people when they're in situations like this?
Absolutely. And we are so equipped in ENT with so many different cool tools to do so. I think it's unique in the surgical specialties in that we use microscopes, we use big, standard surgery instruments, we use endoscopes like the one I use for sinus surgery, and flexible scopes. And we just have all these great tools at our disposal to help people. We see patients from what they say is cradle to grave, and any age range. So that makes it a lot of fun. The landscape's constantly changing. And we can really have a profound impact on someone's life, saving their vision, saving their airway, that kind of thing. It's a very rewarding specialty. Mm-hmm.
Well, I should have told viewers during the Facebook live chat, they are welcome to comment in the comments section. So even if you put one out there and we don't, reach it today, we will definitely put you in touch. We'll get in touch with the right experts such as Dr. Barnes to get answers to your questions. With that, I think we'll wrap up the Halloween edition of Moments in Medicine Live. Dr. Barnes is available along with a multitude of colleagues who are just really excellent at what they do. And as you can see, they're nice people too. They let me have a little fun today, and I really appreciate that.
Yeah, thank you.
To schedule an appointment with an ENT specialist at Nebraska Medicine, you can always call 1-800-922-0000. Or you can go on our very helpful website, which is nebraskamed.com, and there's a nice little search for doctors area on the site as well.